Okay, so we'll talk about the last part of the integumentary system. We stopped by talking the hair, baldness, different types of baldness. Skin cancer or carcinoma, same thing. Skin carcinoma or cancer. The difference between cancer and carcinoma is cancer could be everywhere, right, in the body, in any tissue. Carcinoma is more specifically indicates the cancer of the skin. Okay, so that's why we use carcinoma, which indicates the cancer of the skin. Now, the good news is most of the skin cancers are not malignant. That means benign. You know there are two types of tumor, benign and malignant, right? Which is good. Benign is not harmful, harmless tumor. And malignant is dangerous, harmful. Benign tumors or cancers don't metastatize. That means do not spread, localized. So that's why it is good. Now, what are the risk factors of skin cancer? One common factor is UV radiation. Exposure to sunlight, excessive exposure or overexposure to UV radiation can cause skin cancer or carcinoma, because UV radiation can pass through the superficial layers of the skin and enter into the deep layer. And you remember, innermost layer of the epidermis is stratum basalis, which has a single layer of stem cells, right? So UV radiation can change the DNA of those stem cells. And if the DNA is changed, then the cell will start to behave abnormal. Make sense? DNA controls the behavior of the cell. You know that, right? So if the DNA structure is changed, that can cause uncontrolled multiplication of the cells, and that is actually the cancer or tumor. Another risk factor is frequent irritation of the skin. What can cause excessive irritation? You know, if you touch the chemical, that can change the structure of the cell, right? Those people, you know, work to fix the road or build the road, they use the chemical tar, right? That if you get too much exposure to that chemical, that can change the behavior of the cell, and cells can start to multiply, proliferate, uncontrolled. Make sense? So that's why you need to make sure you protect your skin. Sometimes you'll see that the lotions are, you can purchase in drug stores. They said 100% UV protection or 80%, 70%. Some of those are not really good. Okay, so don't trust everything as written. There are some good lotions, but not all. So this is very wrong. Lotion cannot fix DNA. Okay? Fixing DNA is not that easy, and a lot of research is going on, right? You know that genetic engineering, how to fix DNA, but still we are not, that successful. It's not that easy. So lotion, of course, cannot do that, but lotion can prevent the UV radiation major types of skin cancer or carcinoma. Basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is more common, most common, and least malignant. That means it is a good news, right? Most common type of skin cancer is least malignant, okay? Least harmful. Then squamous cell carcinoma is second most common type, and melanoma, which is the most dangerous form of skin cancer, okay? Because the metastasis is very high in melanoma. You know melanocytes, the cells produce melanin, they proliferate abnormally and cause melanoma. So melanocytes are responsible for melanoma. So now you think melanocytes in your epidermis has good function. What is that? Production of melanin. You remember in last class I said melanin forms a shield against UV radiation, right? So melanin protects it from UV radiation. But if melanocyte, DNA of melanocyte get damaged or changed, that can cause melanoma cancer, right? So it could be dangerous too. Basal cell carcinoma, in this type of carcinoma, stratum basale cells. Stratum basale, innermost layer of the epidermis, we talked about that in last class, that has stem cells, right? Stem cells. So if that layer cells proliferate and invade into the dermis and hypodermis, that is basal cell carcinoma. This type of carcinoma can be easily treatable. Surgical removal of the tissue will cure the patient in 99% of cases. So easily curable by surgical removal of that tissue. You see this patient, he got basal cell carcinoma, squamous cell carcinoma. Which cells are involved? Keratinocytes of stratum spinosum. In stratum spinosum layer, you have keratinocytes, keratin producing cells. You must remember I explained that in last class, right? Keratinocytes produce keratin. Melanocytes produce what? Melanin. So, in this type of cancer, the keratinocytes, keratin producing cells, proliferate abnormally, and most of the cases, this type of carcinoma occurs in certain areas in your body: scalp, ears, lower lip, and hands. Those are the common places where this type of cancer is seen. Good prognosis if treated by radiation therapy or removed surgically. So, by radiation therapy, you kill the cells by radiation. And surgical removal is also helpful. Sometimes we do both. We remove the tissue surgically and also kill the adjacent cells by radiation therapy. Melanoma involves melanocytes, melanin producing cells. Now, melanoma is the most dangerous because the metastasis is high, right? It invades in deeper tissue, spreads a lot. And that's why treatment is difficult. For example, you see here, from outside, you can see that melanoma has occurred in this area. But if you go in the deeper tissue, you will find that it has been spread a lot. Does that make sense? So from looking outside, you cannot tell how much tissue is involved. That's why widespread surgical removal is needed. Not only removing this tissue is enough. You have to remove a larger area. Melanoma can be identified by looking at the color. Melanocytes produce melanin, right? So if the number of melanocyte is very high, for example, in this area, the number of melanocyte has increased a lot by multiplication, right? Then what will happen? That melanocytes will produce more melanin in this area because you have more melanocytes. So the color changes, right? So usually dark, sometimes bluish, brown color, depending on the type of melanin. Sometimes we use chemotherapy. We inject certain, antibodies that will specifically find the abnormal cells. Will go to that area where you have abnormal cells and will bind with those cells and destroy them. Okay, so that is another way to destroy those abnormal or cancerous cells. That is called immunotherapy. Immunotherapy. You inject antibodies, and they will find the abnormal cells and destroy them. Burns. Another common clinical problem related to tissue, skin is burns. Now, burns can be classified based on which layer of the skin has been damaged. First degree burn, second degree burn, third degree burn. If you see that only epidermis is damaged, the outer layer, right, of the skin is damaged, that's the first degree burn. Dermis is intact. The sign of first degree burn includes redness, edema or swelling, and pain. So from outside you will see redness and swelling. Second degree burn, if you see the epidermis and part of the dermis is damaged, that is the second degree burn. In this case, you will see blister, whitish patches appear, and that is second degree burn. Third degree burn is most dangerous type because both the dermis and epidermis, both epidermis and dermis are entirely destroyed or damaged. And in this case, there is no, since the whole skin, both layers are destroyed, right? So no stem cell is remaining there. No stem cell is there. So producing new skin is very difficult. Make sense? So in this type of burn, third degree burn, you need grafting. You need to get skin from another part of the body and put it there. Make sense? Third degree burn, initially you don't feel any pain because since the whole skin has been destroyed, no nerve ending is there. Make sense? Nerves have been destroyed. So the sensation is gone too. So initially we don't feel any pain due to the destruction of the nerves. So those are three types of burn based on which layer of the skin is damaged. Now the main problems of burns are two things. One is loss of fluid. That means loss of water from the body. That causes what? Dehydration. Very good. We know that. So dehydration is one big concern. Another is loss of electrolytes. And that causes electrolytic imbalance. Some electrolytes are very important for your body. For example, calcium, sodium, potassium. Okay? Calcium is very important for muscle contraction, right? And you use the muscles for breathing, you know that, right? Respiratory muscles of the chest. Potassium is very important for the function of your heart. Make sense? Contraction of the heart. So if those electrolytes are lost from the body, you lose those electrolytes, then that can cause serious consequences. Dehydration can cause serious consequences. So these are the reasons why the burn patients, may die. Here, you see, in some areas, you see the redness only. Those areas got first degree burn. Here you see the blisters, so second degree burn. So this person got both first degree and second degree burns. Okay, so she's studying membrane transport. Okay, so you can do it outside the classroom too. Don't need to come here. Here you see third degree burn. Third degree burn is complete destruction or damage of the skin, right? Both layer epidermis and dermis, both are destroyed or damaged. So in that case, you need grafting of the skin. Here you see this person got third degree burn. Okay? So he will need to get the skin from another part of the body. It's always good to get from your own body, because the immune response will be less, right? If you want to get from another person's body, immune response is a big issue, right? It may not accept it, okay? There's a good chance of rejection. Yes?
I've seen that they recently started using fish scales for burn patients.
Recently used what?
Fish scales.
Fish scales. Yeah, there are different technologies now,
I just
that
wanted to know what the process may be behind it.
it could be more like plastic surgery, this just, replace and, use plastic surgery. But I don't think there is any stem cell in fish scale. I don't think so. But if you can get, the most important research is now going on is getting a stem cell and put it there. So stem cell will proliferate and make new skin there, okay? So I'm not sure if you know about that. Is there any stem cell there?
No, they use pig bladder.
Not that I know of.
Pig bladder, like stem cell and pig bladder they use to regrow tissue and skin.
Yeah, stem cell is the most effective way to just, get a stem cell and, put it there, so stem cell will proliferate to make new skin. But plastic surgeries, they use many different things to look like your original skin. Now, how much body surface or skin got impacted by burn is decided by a rule that is called the rules of 9. Okay? Like this person, Okay, so rules of 9. The whole body is divided into 11 nines. That means that is 99% of your body area. And then the pubic area, your genital organs here is 1% area. Okay. So now let's see what are those 11 nines. Okay. So first, the head is 1 9. Then upper limb 9 1 9 1. The front of the trunk 2 nines. Back of the trunk 2 nines. Okay. Then each lower limb is double of upper limb. So 2 9 2 9. Because you know lower limb is much bigger than upper limb, right? Lower limb is much bigger than, almost double than the upper limb. So each upper limb is 1 9, lower limb is what? 2 nines. 2 9. Okay. So how many nines you got? Can you tell me?
11.
You got 11. Okay, so that makes sense, right? So 11 9, 99% of your body. So 2 to 4 and 4 8 9 10 11. And this is 1%, the pubic area. So that's how we decide how much skin got damaged. If only one upper limb, we'll say 9% of the body surface. Okay, 2 upper limbs, we'll say 18% of body surface. Make sense? Okay, so that is called the rules of 9. If I ask you, show me the rules of 9, you will draw this picture. Okay, you can try to draw like me and explain. Can you explain it?
Mm-hmm.
Okay. Nail. Nail belongs to the integumentary system. Nail is formed by keratin, the protein keratin. And this is the true color of the keratin because there is no melanin here. Make sense? This is keratin too, but you have a lot of what? Melanin. That's why you get the color of your hair. Skin has color, right? So has some extent. Skin also has melanin, but nail doesn't have any melanin. That's why this is actual color.
White and pink.
Yeah, because under the body you have blood circulation. That's why pink, right? The free edge doesn't have any blood circulation underneath tissue, so that's why. So the free edge, that's the actual color of this nail, the free edge. Anyway, this nail, we'll go very briefly. I told you in last class that, I don't like the nail a lot, like spending too much time with the nail. So just you need to know the parts of the nail, that should be fine. So the parts of the nail includes body, free edge, root, nail force, proximal and lateral nail force, eponysium, hyponysium, nail bed, lunula. We'll see where are those parts. The part, most distal part that is not supported by underlying tissue, that is the free edge, and the part that rests on the tissue, which is called the nail bed, is the body part. So body part rests on the bed. And then the most proximal part that you can see, whitish color, crescent shape, that's the lunula. So those are three parts you can see from outside: pre-edge, nail body, and lunula. But inside your finger, you have other structures of the nail. Anyway, we'll see those parts later. Now, if I just cut this way, you will see the body of the nail. This is the bed, underlying tissue, okay? And in both sides of the body of the nail, you have lateral nail folds, lateral in both sides. And just behind the lunula, you have the proximal nail fold. So lateral nail folds and proximal nail fold. Those are the structures you can see from outside. Now, the part goes inside the finger tissue, includes the root, nail root. This is a very important part of the nail because you have stem cells in that area. It is like hair. So, new cells are produced in this area. Okay? And that's why the nail grows, right? That's why nail grows. Small amount of tissue, very small, tiny amount of tissue that attaches the free edge and the fingertip. That is called hypomysium. Free edge to the fingertip. Another small amount of tissue that connects the lunula to the skin. That is called eponysium. So those are the structures of your nail. Let's quickly go over again. From outside, you can see the most distal part, which is not supported by nail bed. That is called what? Pre-edge. Very good. The big part that is supported by underlying nail bed, that is called the nail body. Is it clear? And the most proximal part, whitish, that is the lunula. And you have lateral nail folds and proximal nail folds. And inside the finger, you have the nail root and two tiny tissue structures. Those are hyponysium and eponysium. Okay. Got it? Everything? Okay. If you have any question, you can ask. If not, then let's see. Where are we?